Dr. Prashanth. Before this conversation, if somebody had told me your nose decides whether you wake up fresh or like a zombie, I'd probably laugh at them. But apparently, you ENT people have been secretly blaming the nose for years. So help me understand this. Why should we talk about nose when we are discussing sleep?
So nose is a very critical organ which many of us ignore or tend to ignore or don't even think about it for a second just because it's functioning and you're breathing. So just imagine pinching your nose and staying still by closing your mouth as well. What happens? You go in for suffocation. So that's exactly what happens when you're lying down, when you're sleeping. So nose, when it gets blocked, you will constantly be tossing around in your bed. It also leads to your brain not functioning properly. That's where you will not go into your deeper states of sleep. That's why the people tend to wake up very fast, very quickly. All of these are because of the nose. So if you're not breathing properly through your nose, your sleep is definitely going to get disturbed because the oxygen from the body is getting reduced. Hence, sleep breaks keep happening.
So basically, sleep is not about quantity, but also about quality.
Exactly. The quality of sleep is very, very important to ensure that the whole body goes into deep rest, the deep sleep. The light sleep will just give you a sense of you just sleeping, but actually you going to the deep sleep is where your whole body gets relaxed, your immunity gets boosted, your hormones get regulated better, and also the dreams come through properly. The REM stage has to be reached. So if you don't sleep deep enough, you will not have proper day next day, and also the energy levels will be totally low, leading to your daytime fatigability and daytime sleepiness and brain fog and various other issues.
I know someone who sleeps for 6 hours and wakes up like Avengers. And there are others who sleep for 10 hours and wake up as though Windows updates got interrupted. Right?
So this is exactly why I told you it's more about quality than quantity. Even if you sleep for lesser duration, but sleeping with your breathing through your nose and keeping your mouth closed is very important than sleeping for longer duration with your mouth open and not getting good sleep. So quality is way more important than quantity.
Okay, confession time. How many of you sleep with your mouth open? My wife says I sleep like I've just run a marathon.
So when you sleep with your mouth open, your tongue tends to fall back, and that leads to snoring. And also because your mouth breathing, the whole airway gets dried up from your mouth till your lungs gets dried up. So when that drying up of secretions or the mucosa gets dried up, the diffusion of oxygen doesn't happen because for everything to happen, your oxygen has to be moistened through your nose. When that is not moistened or humidified through your nose, the diffusion kind of gets reduced, and because the diffusion reduces, the chances of your blood getting the blood getting good amount of oxygen reduces. So that's why your wife will tell you that you have run a marathon in the sleep. So that's because the whole air is not going into your lungs, and your face also looks very, very tired, and that's why you also tend to have a puffy face. The whole reason why you have a puffy face is because when you're mouth breathing, the air goes into your parotid ducts and the parotids tend to enlarge. So that's another reason why many of the mouth breathers will have a round and puffy face.
So, mouth breathing isn't just ugly for family photographs, it's actually bad for your health.
Yes, they're quite unhealthy. So because you are mouth breathing, it's leading to snoring, and because of snoring is not at all good. That leads to various other issues like diabetes, hypertension, and because of diabetes and hypertension, chances of heart failure, stroke, and other issues can be more. It also leads to sexual dysfunction in men and various other period related issues like period cramps, irregular cycles, PCOD in females. So it's quite not good.
So, that was going to be my next question. Is snoring funny, annoying, or dangerous?
It's a slow killer, slow, loud killer. It's not a silent killer though, like regular people. It's a slow, loud killer.
Because in every Indian family, somebody snores, and we have just accepted that as background music.
Yes, that's something which many of my patients, or whenever I'm giving a talk in any corporate office, many of them do tell that they encountered some uncle who was doing a very loud snoring, and it was like a tractor going around in the room. So that kind of scenario comes up, and even in spite the person is quite deeply in sleep, but unfortunately the others around him usually can't sleep, and they'll be cursing him, so that becomes a butt of all jokes later on.
Yeah, so technically, it's not just impacting them, it's also impacting the entire family.
Yeah, that's why there's a lot of sleep divorces which are happening. So that's why spouses don't sleep in the same room, and that's what is becoming a sleep divorce.
Suppose somebody watching this doesn't know they have a problem. What should they watch out for?
First and foremost thing, the spouse, you can just ask the spouse, hey, am I snoring? So the spouse will be the first one to tell yes, you do or you don't. Second one, if you don't have a spouse and you are alone, you can just assess yourself by checking your mouth in the morning when you wake up. Is your mouth dry when you wake up? Do you immediately go for getting a glass of water to moisten your throat? That means you're not breathing through your nose, your mouth breathing. Other thing nowadays with the whole fad of smartwatches, though not this is not a smartwatch, the smartwatch which is going around, so you can track your sleep with using a smartwatch, and you can figure out the red flags which are highlighted in the sleep tracking software or in your watch. They will It can raise the red flags, and you can definitely tell that you are not having a good sleep because of nose block issues.
So, if you are waking tired, constantly sleepy, irritable, snoring, getting headaches, or having poor concentration, maybe it's time to get your nose checked.
Yes, definitely. All of these symptoms are secondary to improper nose breathing when you're sleeping. So, if you are not breathing properly through your nose, these symptoms are coming up, and also the symptoms of diabetes, hypertension, PCOD, dysmenorrhea, sexual dysfunction, body pains, fibromyalgias, uh, daytime errors, daytime sleepiness. All of these symptoms are definitely a part of the improper sleep cycle.
This brings me to sleep apnea. This is where things get serious because everybody is joking about snoring till we mention sleep apnea. And suddenly, Google convinces us we have just 10 days to live.
So sleep apnea is a issue where what is apnea? Apnea means cessation of breathing or stoppage of breathing. So sleep apnea is stoppage of breathing when you are sleeping. So this is definitely a serious condition, but don't just Google and believe Google whatever it says. Definitely, as I mentioned, snoring is the loud, slow killer. It's definitely a killer, but it's not a very acute killer. It leads to various other issues which can cause your sudden death because of stroke or heart attack. So before you progress to that, get yourself checked and prevent that in future.
I think half of Bangalore is allergic to Bangalore. Can allergies alone ruin your sleep?
Yes, most definitely. Sleep gets disturbed because of allergies. Because of allergies, your nose tends to get clogged up with mucus and various other issues. So that leads to the nose getting blocked further and disturbing the sleep much more. And that leads to further mouth opening and the tongue falling back, leading to snoring and OSA or obstructive sleep apnea. This is especially true in kids. This is because when the kids are in Bangalore, they have allergies or colds that leads to their adenoids, which is in the back of the nose, that gets blocked further because of enlargement. That further leads to the mouth breathing and snoring. So parents might assume that mouth breathing is just a thing, but no, it's kind of dangerous because one, it reduces their growth ability, it reduces their appetite, it causes them not to focus clearly because their sleep is getting disturbed with micro sleep breaks. So definitely mouth breathing, especially in kids, is not good. And if you ignore the mouth breathing, their teeth goes crooked. So ensuring that they have proper air nose breathing is quite vital.
This surprises me. So, snoring can happen even in kids.
Yes, snoring definitely can happen in kids. In kids, if at all they have a cold, that's when their snoring increases. I have had many parents coming and tell me that my kids snore. Is it a healthy sign? That's far, far opposite, diametrically opposite of safe. It is definitely not good because it leads to various other issues.
So, if your child is snoring, it's not cute.
No, definitely not cute. It's a danger sign which needs to be checked. You need to treat the infection, you need to treat the allergies to ensure that the snoring goes away.
When people hear ENT surgeon, they immediately think surgery. Do all roads lead to operation theatre?
Not always. First and foremost, we need to identify what is the cause for the nose block. How frequently is the nose blocks happening? If it's an acute nose block, just it can be because of usually the colds, viral infection. So once we treat the nose block, then the issues will reduce. But if in case it's allergies, then we'll have to assess what kind of allergy is happening. Put them on regular medications, put them on lifestyle changes like steam inhalation, saltwater gargles, and other instructions which I might provide. And also, only the last resort is surgery. When all these things don't get fixed and these issues are chronically repeating in spite of taking multiple medications, that's when surgery is advised. Otherwise, surgery is not always advised directly.
Because Indians are very creative. We'll try steam inhalation, Google remedies, grandmother remedies, YouTube remedies, everything before seeing a doctor. If you could give one thing for everybody watching to sleep better, what would it be?
So one thing which I would advise, and I can't just tell one thing; it's multiple things which I would advise as a lifestyle change. First and foremost, ensure that you are doing your steam inhalations. Ensure that because steam is the best mucolytic, don't put anything into the steam. Just plain steam water that will go inside the nose. It's the best mucolytic. It will thin out the mucus and it will come out. So when I say stimulation, don't do it for 10-20 minutes. Just 2 minutes of proper stimulation through the nose is more than sufficient. Anything more than 2 minutes will destroy the mucosa, and that's not good. Second one is saltwater gargling. Saltwater gargling will reduce the congestion in the throat and they will feel better. Third important thing is to have meals 2 hours before sleeping, water 30 minutes before sleeping. Because that will prevent the acid reflux and also it will reduce the pressure on the lungs. So the breathing is better. Fourth one is sleeping in an inclined position to ensure that the blood from the head goes to the heart more easily and there's no much of nasal congestion. So these are the few tips which I would advise them to follow, such that they can get a little bit of better sleep, such that they can sleep in peace.
So, doctor, is it fair to say that if the issues are chronic, then these options may not help? It would help only if we are unwell or having a cold or something like that. Otherwise, go see a doctor.
So whatever tips I told is applicable both for acute and chronic issues. Despite of doing all these things and still they have issues and they have nose blocks which are happening repeatedly, sleep is getting disturbed quite significantly, not just of theirs, even their spouses, then yes, they need to consult an ENT.